Hello, good morning, good afternoon, good evening, everyone. It is with a great pleasure that the University of Santa Cruz do Sul, UNISC, member of the Consortium of Community Universities of Rio Grande do Sul, COMUNG, starts with the webinar series offered for this 2020 second semester. I'm Christina Miller, coordinator of the International Office here at UNISC, and also coordinator of the Internationalization Working Group of COMUNG. COMUNG is comprised of 14 educational institutions marked by the strong bond with their communities that also represents a true network of education, science, and technology covering almost all municipalities of our province of Rio Grande do Sul. They are authentic, non-state, public, non-profit, democratic, and participatory institutions that prioritize higher education. On behalf of the Internationalization Working Group of COMUNG, I would like to welcome everyone who will join us in this first webinar and also in the next 12 webinars from this series. We really hope that the current collaboration and changing times for internationalization could be a great opportunity to increase the global relations between researchers, faculty members, students, and people who are engaged to make this a better place for everyone. I share the opinion of our rector, Professor Carmen Lucia de Lima Helfer, who is also the president of COMUNG, that education is the only way to have a better future. Today, we will have the presentation that integrates regional to global. Professor Graziele Bettina Brandt will present an important research initiative of UNISC, the Regional Development Observatory activities in research networks and in the COVID-19 context. Graziele Brandt is a full professor and researcher here at UNISC in the Department of Business Management and also Communication. She integrates the graduate program in regional development since 2013. She also was visitor professor in the Education, Culture, and Development program at New York University in 2018 and 19 in US. She has a PhD in regional development at the Université du Québec à Rimouski, Canada. She also made a postdoctorate internship at the graduate program in the Federal University of Rio Grande do Sul here in Brazil. And she also was a Fulbright Fellow at the Multinational Institute of American Studies at New York University in 2018 at USA. So thanks, Graziele Brandt, for being with us, for accepting this invitation, and for being able to share a little bit about the work you're doing as a teacher, as a professor, as a faculty member here at UNISC. Just before Graziele Brandt starts, I would like to do some important remarks. Comments, questions, and any interaction the audience would like to do with Professor Graziele could be submitted through the YouTube channel, just here in this website. Also, I would like to remember that this webinar and the other series will be recorded and will be available for everyone just doing access through this channel of COMUNG at YouTube. So, Graziele Bettina Brandt, thank you again, and the web and the virtual floor, it's yours.
Thank you so much, Chris. Good morning, good afternoon, good evening, everyone, welcome. I would like to thank you for this opportunity. Thanks, COMUNG, the University of Santa Cruz do Sul, and above all for Christiana's work in making this meeting possible. To say that I will have an accent that mix Portuguese in French in English. Okay, let's go. Today, I will tell you a little bit about our research developed in the postgraduate program in regional development at the University of Santa Cruz do Sul. First, I would like to speak briefly about the university. We are a community university, and the work to our regional reality is one of the pillars of the university. we have a profile based on the community university model turns to the demands and needs of our regions. Since of March, our research commitment to the community came strengthened due to the coronavirus pandemic in our region. The classes at the university go online, and the university begins to act on several fronts to minimize the impacts of the pandemic in our region. Works like rapid tests in pharmacy and medicine courses, free distributions of alcohol gel and soap to the community, produced by chemistry and engineering courses, production and distribution of food for the most vulnerable people. Add to business and small companies in the pandemic with the business and communication courses. With the pandemic, our commitment to society increased even more. It's very important to say at this time of pandemic, community universities have made a difference for their community in their regions of activity. And as a researcher, I am proud to make a difference. UNESCO has been a great supporter of several activities to reduce the impacts of COVID in our region. And Brazil is able to minimize the impacts of the COVID by the support and work of many universities. Second, I would like to introduce myself. My name is Graziele Brandt. Briefly, I am a professor and researcher in the Department of Communication and Business and in the Regional Development Program. I have a degree in social communication and master's and doctorate in regional development. I am currently working on research on COVID specialization in the Valley of Rio Pardo region and also on research on international migrations in the states of Rio Grande do Sul. In the context of the Regional Development Observatory, our surveys are conducted by a group of teachers and students at the program at the Regional Development. Observa-DR COVID-19 is a project that proposes part of the Regional Development Observatory of the postgraduate program in regional development in partnership with the Geography, Social Communication, and Architecture and Urbanism courses. We offer secondary database and thematic maps and notes with scientific information in the context of social, demography, infrastructure, and health variables. The intention is to provide useful information and to plan actions and make decisions to prevent and combat the pandemic caused by the expansion of the coronavirus, as well as to offer scientific information to society. The new coronavirus pandemic began in February in Brazil. In August, Brazil reached 100,000 deaths. It's so heartbreaking. There is no single picture of the coronavirus pandemic in Brazil. It advances at different speeds between regions in such a large and diverse country, and the general database provides little guidance on the seriousness of the situation. For weeks, Brazil database have been parked at a worrying level. What we have today in Brazil is a system of several epidemics with outbreaks, waves, and very different variations between regions, states, and even municipalities. In the last few weeks, the coronavirus has been gaining more speed in the South, Midwest, and part of the Southwest states. These seats seem to have been spared the most at the beginning of the pandemic, but the decisions of local managers and the characteristic increase in respiratory disease during the winter in these regions, which begin in June, are some variables that drive growth. We still have some political aggravating factors in the case of Brazil. We have been without Minister of Health for more than 3 months. a federal government that does not have a good relationship with the national press in general, and disregard for Brazilian science and scientists. From this difficult context of the pandemic in Brazil, and thinking about doing our part as a researchers, we have carried out a systematic work of scientific communication on COVID. We have a website portal that serves as a repository for our maps, scientific notes, and news about coronavirus in our region. From the database provided, we start to create podcasts with specific themes. This made by teachers and students in regional development. Since May, we have started to intensify our work to disseminate database and scientific information about the pandemic on the observatory's social networkings, especially on Facebook and Instagram. Now I would like invite all of you at the moment to know a little bit about of our work, and give me a little moment. I would like to present our website. It's possible to see the website. Yes, Chris? Okay, this is our website. It is divided between news, database, publications, podcast, observatory network and partners, like this. We have news here. We have some publications. It's possible to see ebooks, scientific reviews, and some works of students and researchers. Videos. In videos, it's possible regard the lives and webinars, and some podcasts developed by students and teachers. And it's possible to see, especially our project Observa DR COVID-19. And this project, the team is coordinated by Professor Rogério Silveira and has the participation of professors and students of the master and doctorate in regional development at UNISC. At this moment, I would like to present some database on the evolution of coronavirus in Santa Cruz do Sul, in the city of Santa Cruz do Sul. We have some maps, notes with scientific information, and I would like to share you, especially some graphics and maps. This graph below shows the four-line behavior of contagion and deaths of COVID. As well, it is a percentage variation and moving average. The systematized period corresponds to the interval between the months of March, first fortnight, to August, 11th fortnight of 2020. Now, at this moment, we are currently at the peak of the number of cases since the beginning of the coronavirus in our region. Observing the database regarding the evolution of the number of confirmed cases with COVID in the municipality of Santa Cruz do Sul in the period between end June and end July, we verified that in the total number there was an increase, representing 106% in case. Therefore, in this period, there is a constant growth rate in the number of cases in the municipality. We can see now this map. I'm so sorry, but here we can see this map. And with this map, it's possible to see the number of the case in the COVID in the neighborhoods. This increase the number of the case, it's very large. The center of the city show an increase of the 172% of the cases. This increase in case is due to the higher concentration of people and the agglomerations in the flows for trade and service, and the ineffective social distance verified in the streets and public space in the neighborhood, notably on weekdays. Another map, a little attention for the another map with I would like to share another map with you guys about, especially about people age more 60 years. Here we have a lot of information, but this map seeks to represent the Asian population of the neighborhood and also how the spatial distribution of the elderly population is presented, aged 60 or more, between neighborhoods in the city of Santa Cruz do Sul, based on official data. In this sense, knowing how much the elderly are and where they live in the city is of fundamental importance for planning local prevention and control actions in relation to COVID, as well as follow-up and healthcare actions for of these potentially more vulnerable populations. And we have another map that I would share for you. It's the distribution of service of the supermarket, market, and another service for the population here. These maps represents the spatial distribution of an important service for the population, and that requires the displacement for their homes to him for the care of their needs, the location of food commercial establishments, markets, supermarkets and fairs, medicines and hygiene products. For in addition to daily commutes, reduce in the isolation times. The main reason for displacement is to access to trade and foodstuff and other items of daily consumption, essential for the maintenance of families. The needs of displacement of the population that, despite the restrictions and isolation, continue to be necessary and carried out. able with a frequency reduced in relation to what happened previously. It is important to note that these commercial establishments are not always close to the population's homes, even because there is no way to have a supermarket and each block fair pharmacy. Thus, it is noted that the distribution of the commercial points of foodstuffs, of medicine, and other products necessary for the maintenance of families is an example of other service. It's concentrated from the central part of the city. We have a lot of information, as you can see, and you are invited to visit our website and our social networks. We have faced this challenge in different ways according to the context of pandemic in Brazil. And at this moment, it's important to see the university mission to serve society and generate knowledge has been fulfilled in the context of pandemic, responding to emerging social and technological demands. Far from having suspended activities, professors, researchers, and in many cases, students are engaged in meeting different needs in the current context. Although most universities have suspended face-to-face activities to promote social isolation, administrative work as well, research and retention. Not only continue, but have proposed numerous activities in new formats to assist the country in tracking the pandemic. I would like to thank you for your attention, and especially Cristiana for your dedication to produce this moment. I would like to thank you to the Observa DR team. Thank you for our teamwork and for choosing me to represent each researcher involved. And thank you so much. Now I am open to respond our questions. Thank you.
Thank you. Thank you, Professor Grazielli Brandt. Thank you for showing a little bit about what are you developing in the observatory, how we used to name it to say in Portuguese, Observa DR, Regional Development Observatory, here from Unisc. As we have defined to have a short presentation, I think everyone who is going to watch this webinar later probably can contact us. We are going to put on the chat our contact and even the general contact of COMUNG. So what is important here, it's maybe just to emphasize that the Observa DR, it's a place that engages in interdisciplinary research and with also an interdisciplinary team of researchers. And they have a huge and important dialogue with other centers of research in Brazil and also from other countries who are going to increase their help, their support through their research with the fields of health science who are facing the COVID pandemic worldwide in our country as well in the region. And how do they contribute with their research and with these important social data, for example, to stop or maybe to help to stop to spread out of this virus. So this is something new for the Observa DR, how to develop research in this field, but they are very important in terms of how to create the interactions between the university as a community university with the community demands. So everyone it's welcome to try to find out the other data who are available. If you need some support on it, please feel free to contact us, COMUNG, and even the international office, and Professor Graziele as well. Thank you again. I just want to check if there are some questions here. And if there are some questions, I'm just going to ask for you. Maybe just to talk a little bit, Professor Gazi, about the interactions you are doing with other researchers and other groups who are also focusing in the same field, but in Brazil, because you are much more focusing in the local. With the maps that Professor Graziele shows, for example, they were maps from our region, from Santa Cruz do Sul, where is the main campus of UNISC. So maybe just to add some information, how are you dialoguing and creating some contacts with the Brazilian groups also focusing in the same field? Maybe this is just a question, a general one, maybe just to help to give a general overview about the context of Brazil in this field.
Thank you, Chris, and it's a good question. We have a network with Observatory BR. We have a network of researchers with 24 universities. It's very important for us, this exchange with another researchers in Brazil, because we have a different reality of the pandemic in Brazil now. Different waves and different cycles of the pandemic. In the beginning of the pandemic, the states of the north and the northwest, it's the states more touched by the pandemic. And now it's the states of the south and the parts of the southwest. And for the observatory, it's very important exchange this information, that we have some variables and we can tracking another regions with our partnerships and follow up the actions and the urban planning for tracking the pandemic and in the same time we have some webinars with some researchers in the Latin America context. It's the first webinar that we produced. It's five big regions in Brazil: South, Southwest, North, and center of in the center of Brazil. Okay, and for this first webinar, we exchanging a lot of information in different states and even municipalities in Brazil about COVID. After that, we prepared a second webinar. The second webinar was more large. It's America Latina countries. We prepared this webinar with researchers from Uruguay, Argentina, Chile, and Brazil. And it's an opportunity to exchange information about this country and about its variables to analyze and more comprehensive context of the pandemic in the Latin America. Okay, it was very, very important. Now we prepare a third webinar with the world, with some partners in Canada, in the United States, in the Europe, in the Asia context. The work in the observatory grew up with the pandemic. Now we have new challenges. new challenges for provide database, because it's not easy in the big country like Brazil. It's not easy have to access this database, and we work hard at this moment for produce this map, these notes, and exchange with another university. But the whole of the universities, it's very, very important in this context. I think it's the more important whole to tracking the pandemic in Brazil. I don't know, Chris, that but we have a lot of partners, and here we work with the press and the regional press for produce our maps and notes and information and news about coronavirus, and especially your specialization in the region. And we have a good contact. We have a good acceptation for society, for the regional press, and it's important to see that it's possible for us making in research at this moment.
Good, thank you. Yes, we had a question from the audience. It was focusing just exactly on what you were just talking about. It was, do you have national and international connection as well? Yes, I think just the question is from Fabiola Sartori. And maybe you can just add about information, not only in terms of the COVID context, but maybe you can add about what were the relations and the interactions worldwide done by the Observa DR before also COVID context that you didn't finish. You continue with this, you just add the COVID context and your researchers. Could you just add, just to clarify about this global networks the Observa DR has?
Yes, sure. We have some researchers developed at this moment, okay, with Chile, okay, especially Universidade de los Lagos in Chile. We have another project developed with Argentina partners in Universidade de Rio Cuarto. We have another project with we have the contacts with Canadians colleagues especially for the work about migration in Canada, migration in Brazil, exchange about these subjects, and we have we have exchange with Mexico. We have students with Colombia now. It's especially interesting that we have a lot of contacts with Latin America contacts now, okay? But Austria, Innsbruck, yes, Austria, it's a big partner, and maybe the most consolidated relationship that we have in terms of research is Innsbruck in Austria. And Europe, the challenge is Asia for now. It's a dream, huh? It's a dream. We have a partner in Latin America, and in Europe, in and Asian context. It's a dream for us, and we have we would like to have the new partners in Asia, and we work for that, and in the future it's possible.
Good. We have another comment. It's from José Alberto Antunes de Miranda. He congratulates for the studies developed at the observatory, but it's not exactly a question. And maybe from the audience, and maybe in the future, we can increase these relations from the observatory with Asian institutions, exactly also to know how do they look in terms of regional development, and also in an interdisciplinary way. So if there are no more. I cannot find any more questions. So, but we have already on the chat the email address from the international office from UNESCO. So we are available to reply any question anyone would like to send us and ask more, and maybe to create relations with the Observa DR here from UNESCO. So we'll be very proud to reply any question, any comment, and maybe any interactions and from someone who will be interested on it. So maybe I would like, as we have no more questions, I would like to thank you again, Graziele Bettina Brand, our colleague, our professor here at UNESCO. I would like to thank everyone who joined us here. And I'm sure that the regional context is also very important to understand the global context. And the COVID just came through to emphasize that global, local are very, very linked. We cannot think in terms of people, education, and research if we do not think globally, and focusing for sure in local demands and global demands, and local solutions and global solutions. So thank you again for presenting us a little bit about what Observa DR is developing here through the University of Santa Cruz do Sul. And before we leave, just have one more message. Yes, I have just I would like just to remark about, and before we leave this webinar, it's to thank everyone, and also to invite to the next webinar. The next webinar will take place next week, exactly in a week, next Tuesday, September 1st at 11 a.m. Brazilian time. So the content of the next webinar will be about the undergraduate pedagogical plan, focusing on innovation and solutions to society's demands, exactly focusing in terms of a community university. And also about the projects developed through a regional and community university, the URCAMP, in terms of the technological and social incubator. So please save the date, join us next week, next Tuesday in our second webinar. And also, if you will be available and interested in some other field that we are offering our series of webinars, feel free to join us, to watch, to share with all friends and academic and researchers worldwide. Thank you again, each one, for being with us, and take care and be safe. Let's keep in touch for a better future. Thank you.
Thank you.